Hello, everyone. Thank you for coming to Entera's Liftera Symposium. Before we start this session, it's a pleasure to receive all speakers from all over the world sharing their experience with Liftera. For the first lecture, I would like to invite Dr. Iñigo De Felipe to share with us your huge knowledge.
Oh, I have to...
What do you prefer, Doctor?
I think it's fine with this. Yes.
Okay.
Otherwise, I would look like I'm having an ice cream in a very cold room. My presentation today is quite simple because I don't have the experience the Brazilians have. You do thousands and thousands of procedures. We just do hundreds. So, important facts that I want to share with you today. First of all, how technique is important and how it is related to the results. Because I think that we haven't talked enough about this, but there is something that we discovered in our technique that wasn't yielding correct results, and I'm going to share with you. Right, second, the number of shots. Everybody talks about results, but nobody focuses very much on the relationship between the number of shots and the results obtained. Also, regarding the price, it's surprising how some patients of yours say, no, they charged me 300, they charged me 3,000. And there is such a variety of different prices that you say, well, maybe they are giving them less shots or less treatment or less energy. And third, which is what I was brought here, the safety issue. How many adverse events do we have? So, this is one of my patients, and this is the pen. So how fast am I moving the pen? How fast? So as far as I know, if this is 10 hertz, it means that for every second you're going to give 10 shots of about 1 millimeter. They're not really very big, which means that if you move that at a speed of 1 centimeter per second, you're going to stack all the shots in the same line. But if we move this fast, right, which is about 10 centimeters per second, you're going to give the shots very far away. So maybe this is too quick, all right? So say this now. Because I've seen in some people working for me, they do like this, especially when they work with a 4.5. This doesn't work. You defocus the pen totally, there's no effect. So you shouldn't work this fast. 20 centimeters per second is not good enough. Then you have this more reasonable way of doing it. So I would say that it's 5 centimeters per second. So it's okay. That's a correct speed. But imagine that I go slower. I go slower. Like this. So the spots are close to each other. Then we are really heating up, and then this really works. So you see how I'm doing? Slowly. Don't run, because most of the nurses that do this treatment, they tend to run, and then the patient complains, I didn't see any result. So that's the first issue. All right. Second, this is about safety, right? Do you know what that is? Well, that pretends to be the artery, the vein, etc. But because the video is moving, I draw it there. But basically, this is the area you should not touch. So what happens if you touch it? Nothing happens. And if you're working with a probe 4.5, nothing happens. I've never ever had... Hi, doctor. I've never ever had a problem with this probe, the 4.5. So when I was trained, please do not give any shots there because that's a non-safety area, etc. There's no problem at all. So I wonder why is this so safe? Maybe because it's very, very well focused. You heat at 3 millimeters at 4.5, but there's no heat at 10 or 20 millimeters deep, right? So you have to skip that, but in my experience, if you don't skip that just by chance, there is never a problem. So it's quite safe. The neck. Everybody's worried about the neck, and there are not many solutions. Maybe 90% of the things that you can find in these stands are for the face, but very few are for the neck, and everybody's worried about the neck. So the neck usually needs this kind of approach, right? Lateral and central, sorry. So this is what you get immediately, an immediate tightening. 12,000 shots, and it's important to spend that long time enough, and this is what you see 3 months later. This works very well, and the best thing is that it's virtually painless. It's very effective and very safe. This is immediately afterwards, and the number of shots is 12,000. So these systems provide satisfaction to our patients always, always, always. It's probably one of the best systems that induces less pain and at the same time is more effective. So let's talk about the safety. So we conducted a study putting together many patients. I think I brought 40-something patients. This is just the top of the table. And as you can see there, what do you find? 0, 0, 0, 0, 0, 0, 0. So there's no side effects at all. Maybe there's a little bit of pain, but the patient doesn't regard that's the pain from 0 to 10. Basically, there's no pain. Maybe one person, that's patient number 12, complained because there was a little bit of pain, but the rest was basically safe. It's safe, 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 right? And these are the results. You can see that all patients improved. You can see there the guys scored 2, 1, 2, 1. So in a summary, and this is the end of my, well, not the end of my lecture, but the end of my data, you can see that the only thing you find, this is a list of 313 patients. The only thing that some patients find is that they leave the office a little bit red. That redness is not present there. So we just had a couple of patients that complained there was no improvement. Some patients that said that for the first week they felt some strange tingling on the face, which I always say it's good, but there was no lesion at all. So this system is extremely safe, especially if you compare it with other HIFUs and the first HIFU or MFU that was chosen. So this is an article made by some other people, right? Safety and efficacy of high-focused ultrasound. And they state that they have no side effects. Here you find 56 people that complained or reported a little bit of erythema, but there was no other complaint. There was no other adverse effect. We don't know, nevertheless, if you read carefully the article, we don't know what system they used. And this was done in Malaysia, I think. So this is what they say, right? There was only erythema. That was the only notable adverse effect. That's the only thing. I mean, you get erythema when you go running, right? When you do exercise, so that's not really an adverse effect. Anyway, so when you go down here, you see that with other systems, you could find, especially with the old therapy, some adverse effects, but there's none with this type of second-generation ultrasound or microfocused ultrasound, all right? So when you see and you review where there are complications with HIFU, these HIFUs are basically very deep. They are centimeters deep. They have nothing to do with the technology that we are working. So with the data that we have, right, we can say that Liftera is very, very, very safe. There are no reported adverse effects, right? All reported effects are related to other systems like Entera, right, or like other HIFUs that penetrate centimeters. They have a different wavelength. And finally, right, I think that Liftera seems safe, painless, effective, and very cost-effective, which is also very good. Thank you very much.
Doesn't matter how many times we watch Dr. Iñigo, we always learn something new. For the next presentation, can you help me? I would like to invite Dr. Patricia Ormiga.
Good morning, everyone. Thank you for being here, and I would like to thank for the invitation, thank Entera and Asterasys, and Congratulations, Iñigo. Where are you? Okay, over there. Very good presentation as always. So I would like to discuss some effects of the microfocused ultrasound, Liftera, that I really like to use in my day-by-day practice. And I think we can share some useful insights to make your practice better. So these are my conflicts. And always when we talk about microfocused ultrasound, we are discussing the target. At the beginning, we started discussing just this mass. But while we came improving our practice, we discovered that there are many targets that we can achieve. So, first, at the beginning, just to the posterior line of the face, the posterior portion of the face, respecting the ligament line, it was the beginning, okay? And when we target this mass, we must remember which depth is this mass. So when we see this video of anatomy dissection, we can notice that we have the skin. Down to the skin, we have the superficial fat, and glued to that, we have this mass. So the depth of this mass depends on how deep is the fat, right? And when we are working in this region, we must remember then, down to this mass, we have the special structures of the face that we cannot achieve, right? So when we are working, we must discover and know in which depth this mass is. So it's the first target. After that, we discovered that we could work on the fat. And we cannot dissolve a lot of fat, but we can have some effects treating the fat. Yes, we can. So sometimes we can use the microfocused ultrasound to work on that fat. When you talk about bichectomy effect-like, of course, it's a bichectomy-like effect. It's not a bichectomy itself, because the bicha fat is deep to the tissue, close to the parotid gland. So we cannot treat as deep with this kind of depth, you know? So we are working on the superficial fat and producing an effect like a bichectomy. So in this paper, published by Casabona and Cotofana, we know that the variation of this mass and the superficial fat is big depending on the face of our patients. So the buccal fat may be, in this region of the buccal fat, maybe the superficial fat can vary from 2.6 to 6.9 millimeters. And so depending on each patient, we will have a superficial fat with a different different deep, okay? So submental fat is another target that we can use. So when we treat this region, we know that many times we are treating the masseter as well. That is the continuation of this mass of the face. So sometimes we can treat the masseter and the submental fat with beautiful effects when our patients ask to do that. And the ligaments. We don't have data showing that, but we already know by our experience that probably the ligaments are a very good target to achieve during our treatments, because we have beautiful results related to the mid-third, especially under the eyes. So probably we are treating very well our ligaments to the middle face. And the skin. We must remember that we have the 1.5 transductor, and then we can achieve the skin, we can achieve the dermis, and always we will have patients that, of course, they lose volume, of course, they have the bone absorption and lack of structure, but they also have the skin laxity that we can treat using our superficial transductors. So, summarizing, we have this kind of 5 targets that we can explore using our Liftera, okay? And another tip that we must pay attention, for example, the pressure that we make while using the transductor will change the depth where you are, right? So if you apply a lot of pressure, we are going deeper than when you don't use pressure. And how much gel you use also will make a different treatment. So respecting the thin layer of gel is also so important as the pressure that you make. So we will use the transductor changing the depth depending on the pressure that we make. And Iñigo said it very well. So since we have the pen applicator, the velocity, how fast I move the transductor will change totally my treatment. So our suggestion is, while initiating the experience with the Liftera, first you must use the linear transductor to the posterior face, and after that you can move to the pen, and giving you the chance to see the best results first, and after that acquire experience to move how fast it needs the pen. So if you move fast, the points of coagulation have a big distance between them. If you move slowly, you can have a beautiful treatment and a proper treatment using the movement correctly. And attention to this area, that is the submalar area. If you treat a lot using a transductor that will achieve the fat in this area too much, you can provoke a kind of effect of going down the malar fat, okay, and coming to the front. And so some patients can notice that. So avoid using a lot of shots in this area, depending on the depth of the layer, the fat of this patient. So we developed together with Entera this kind of rules that we can use to treat different kinds of face. So we divided the face in regular face, where we have what we call a regular amount of fat. We have the skinny faces, and we have the round faces. So depending on the kind of face or the facial shape that you have, you can customize your treatment to achieve the best results. So we suggest to the 4.5, sometimes in a regular face, we must respect the malar area to avoid that kind of effect of consuming fat and going down the malar fat. And then you can treat all the area using the 3.0. But if you have a round face, it's useful to treat the fat a little bit more, and then you can use the 4.5 and all of this region, and you are able to produce a kind of thin face if you treat the fat down to the zygomatic arch. So it's useful to use the transducer, especially the pen applicator in this area, that can produce a very beautiful result. So again, the round face, you can treat the whole area and repeat the shots in the subzygomatic area. And when you have a skinny face, many times you are not able to use the 4.5 transductor, and then you can use the 3.0 in that area, respecting the submalar fat, and then you can use the 2.0 and the 1.5, especially in the frontal face, because you can treat the skin in this way. It is very useful. And since you are able to produce quick treatment, you are able to produce a beautiful lifting effect, immediate lifting effect. So the difference between the Liftera A that you have in Europe and the Liftera 2 that we already have in Brazil, and I hope that you have it as soon as possible, the treatment is much faster. And then we can see a beautiful immediate lifting effect, much more than Liftera A. So I strongly believe that how fast is the treatment, the most you can notice the immediate lifting effect. So, and to add fillers. If I want to add fillers, this is a very useful tool, because you can apply inject the filler, and then use the Liftera in the same session using the pen applicator and respecting the areas where you treat, where you inject the filler. So if I want to treat the same area, I will need to do it in different days, probably. Or I can use the Liftera first and inject the filler later. In different areas, I can make everything in the same way, okay? And independent of the facial area. So this is an example. It's a patient that didn't want to have fillers injected for many years, and then I convinced her to make a treatment, and so I used the Liftera and I injected a small amount of fillers. And then the after procedure is much beautiful, you know. It's a very natural result using minimum amount, using 2 syringes of filler, and then we have this result much improved when you use the microfocused ultrasound. And here I would like to make an observation. In Brazil, we are understanding that microfocused ultrasound, especially Liftera, is a very good tool to slow the aging process. So we are starting using this kind of treatment in very young patients, because since we start improving the collagen production when they are 35 or something like that, we will slow the aging process. So at least once a year with a treatment like that, they will respect the aging process using less injectables that we need. So I will run fast because I passed the time. So this is another example, a very good example in the infraorbital region, that where we prepare the patient to receive the botulinum toxin and the filler. Because if you treat a patient like that in that region with this kind of laxity, I can make my injectable visible, I can have the swallow because of the botulinum toxin, and then we injected her and obtained a beautiful result. Another patient, she would like to have the face thinner and a little bit of lifting effect, and we achieved that. Look, it's a very beautiful result. 2 syringes of hyaluronic acid, and we obtained this kind of lifting effect with the association of Liftera. And this young patient, she would like to seem younger, but she would like also to treat the submental fat. So we started using Liftera, treated the face and also the submental region, and used the filler just to improve the face contour. And we obtained this kind of effect, especially treating the mentalis area as well, to hide the submental fat, to help hiding the submental fat, and we obtained this kind of very natural and beautiful result. So I hope that we can help you with your practice. We love this technology, and I will be at your disposal to talk later, okay? Thank you so much.
Thank you, Dr. Patricia. It's always an honor learning with you. For the next presentation, can you help me? Thank you. I would like to invite Dr. Nikola. Help me with your surname, Dr.
Drmac.
Drmac.
It's impossible to
Thank you very much.
Okay. Hi, everybody. Now, it's been a lifetime that I'm staying behind HIFU technology, but I never bought it because there were some collateral effects, it was painful, and consumables was quite expensive. So all these things, it wasn't easy to propose to my patients. But last year, this congress here, this session here, the first presentation was made by Dr. De Felipe, like today, and he was talking about the music. So in the end of his presentation, I understood well the difference between digital HIFU technology and analogic HIFU technology. So I decided to buy a Liftera. And now, after a little bit less than 1 year, I begin to have some experience. I continue to have my doubts. And I began to find a way how to sell this treatment to the patients. So during my consultation, I don't know why, but whoever used Liftera knows how nice results this device gives us on the texture of the skin, on the quality of the skin, on enlarged pores, even on the colors. But my patients during consultation talk about lifting, only lifting effect. Now, we all know that lifting is age dependent, so if you take the younger patient, you can lift wherever you want. But in middle age and older patients, we risk to have some non-satisfactions. So I find a way how to compensate these things, how to satisfy this request in older patients. So I combine, basically the protocol is, first I do Liftera. In my practice, I'm following Dr. Macedo protocol. Now, as my colleague said before, here is very important not to stick yourself on one protocol. There is many variabilities, the volume of the face, the thickness of the skin, the photoaging. So the numbers, how many shots, the depth, is the variability that you must keep in consideration. Then, after 3 months, in older patients, they must do this bolus site injection of hyaluronic acid. This is a very simple kind of injection. And we have to inject hyaluronic acid exactly under the insertion of SMAS on a zygomatic bone. It is easy to find the right point. It is a lower angle of zygomatic bone. So I inject 0.3 in the forward part, centimeter behind 0.2, and then 0.1 ml. In every phase, the same thing. And on the SMAS and on the skin that received Liftera treatment 3 months ago, we have this SMAS stronger. We obtain this really, really nice natural lift effect without augmentation of volume in the zygomatic area, because some patients don't want to have this augmentation of volume. And even in the younger patients, when they want to do a little bit more, it works. The other thing that I noticed in this year, now from day one that I bought Liftera, Kayla and many others always told me, do not repeat the shots in the same point. You're going to melt the fat, move your canetta, your pen. But there is the point in our face where we want to melt the fat. So one of these fat pads is lower eyelid fat pad. Now, I've been told also, do not use 3 millimeters on eyelid, be careful. But I believe it is a question of technique, how you do it. Now, there is lots of publications that describe how this technology induce adipose tissue loss. And it's not simple breaking the cells. There is different systems that happens, and it is nice to know them all just so we can use them all. Now, the fact that Liftera doesn't hurt, this thing permits us to repeat few shots in the same area. The important thing is not to direct the pen in the direction of eye. And the nice thing, maybe the most important thing, is to push with the finger one side of the fat pad, and then you will have concentrate much more denser the remaining part of fat pad on the other side, and then you applied your pen on that area without pushing too much. Now, with 3 millimeters, you can repeat 3, 4, even 5 shots in this situation using it this way. And after I applied about 30, 40 shots on one side, I changed the side of the finger, and on the other side, other 30, 40. And then patients begin to feel some pain. And then the rest of the shots to achieve 200 shots, I go slowly in that area. It works. So I do 200 shots with 3 millimeters, 200 shots with 1.5 millimeters. It works perfectly. In one single session, I obtained really great results. But the problem is that the patient, you must tell them, they will have 7 days of really nice, important edema. So if you don't advise them, so as we can see, 200 shots, as I said before, it works very, very nice. It is enough to do 1 or 2 sessions. And I noticed that in the younger patients, it works much better. Maybe it's a question of the density of the fat pad, but this is one single session. And many patients don't want to undergo the surgery. So this technique here with Liftera could be a really nice solution. I'm really sorry, but I couldn't find the picture of this patient where we begin. She had such a huge fat pad, and I melted in one single session so much that we find ourselves with all this skin laxity. And patient told me, okay, I don't have any more fat pad, but this skin, so we had to do some sessions with non-ablative fractional 50-50 and then CO2 deep mode to shrink a little bit the eyelid. And the last thing, the neck. Now, I mean, when we treat the neck, we don't work with nice, young, thick neck. We have to deal with photo damage, older, thinner necks. And whoever does some surgery on the neck knows that everything stays in 3 millimeters. I mean, the skin, platysma, fascia, everything is in 3 millimeters. So if we use Liftera, what we have 3 millimeters, and we are really deep on platysma. When we use 1.5, we are still, I believe, under the skin. And the skin, if we want to do the shrinkage, we have to hit all layers. So I combine it in the same session with non-ablative fractional 15-50. I do first Liftera, about more than this protocol, about 1,200 shots per side with Canetta, or in linear way, about 50 shots per side. First with 3 millimeters, then with 1.5 millimeters, and then immediately after non-ablative fractional laser. This is only one single session after 2 months, and in this area here, I received a huge satisfaction from patients. Thank you.
Thank you very much, Dr. Nikola. In the end of the session, we will open to Q&A, okay, if you have time. Can you help me once again to change for the next presentation? I would like Dr. Anne-Marie Olsen.
Hello. Every time I'm invited by this wonderful team to give a talk, I'm excited, I say yes. Then they tell me I only have 10 minutes and I stress out because there's so much I want to share. And I want to, in advance, ask you to excuse me if I have too much information put in here, okay? And I want to thank all the speakers before me because it's almost as if we had planned this. They've really helped with my talk now. And I'm having a blonde moment, but I think it's going to work. There we are. So what I'm going to do today is I'm going to help you, hopefully, put everything my peers before me spoke about into clinical practice, like bring it all together. And what I'm going to help you go from good to great results, harnessing what's unique to Liftera technology. And so most of the microfocused ultrasound devices would give you collagen stimulation, elastin stimulation, and if we want, fat reduction. But what you don't find in the other devices, for me, is less pain, ability to work, well, shorter treatment times, not faster, and also, for me, the amazing pen cartridge. And why is that? Because the pen allows us the precision and the ability to go to areas that normally are really hard to reach. For example, the neck, and a lot of body areas, so on and so forth. And to give you an idea, in my practice, I honestly treat all this, I especially left the neck and face out because I knew someone else was speaking about it, and even more. And I wouldn't be able to do that if it wasn't for the pen and for the minimized discomfort. So we'll do an overview of how to plan our treatments and how to decide our parameters. As the speakers before me beautifully explained, it's very important to have the optimal outcome, to know how to use your device, but also be able to assess your patient, because we're all very different. And I call it the GPS to excellence. So we need to know what our patient wants and manage their expectations. So that's where we want to go. We need to know where we are now and what steps we need to do in between. And hopefully I'm going to help you with all that. So let's go about the device parameters. So a lot of our outcome has to do with our device, not only our assessment ability. And the device parameters depend on two things: the machine itself, and then us as a user. Described by my predecessors again beautifully, we know that by adjusting the depth, the power, and the number of shots, we can decide what we want to do. So now we know that we can either stimulate, but we can also degrade, and we choose what we want to do with that. Do we want to degrade some fat, or do we only want to stimulate? At this point, I just want to make it very clear, and I say this to my students in university, because I see that even experienced practitioners who probably are not dermatologists have a difficulty in assessing when I need to produce collagen and when I need to produce elastin, because they are two totally different things. Collagen has to do with volumizing. Elastin, I like to say, is like the spandex of the face, right? The Spanx, it keeps everything together. And we have the ability, by adjusting the parameters of the device, to choose what we want to induce. And then, of course, we have the user-dependent parameters. So, beautifully mentioned also by Dr. Iñigo, the speed of movement. I control how quickly I want to go. And maybe, because you might all say, how do I know that I'm going quick or slow? I find a nice little tip is you can assess by the discomfort of the patient. If the patient is literally feeling nothing, you're probably going too quickly. And I found, I first started using a device called ultrassom quite a few years ago. And you know, being doctors, we don't want to induce pain. So sometimes instinctively, if the patient feels discomfort, we start going quicker so they don't hurt. Please don't do that, because they'll have a much better result. Just explain to them that there will be a little bit of discomfort, but the fact that you're feeling discomfort means that you would get a better result. Direction of movement. It's too much to analyze now, but obviously, depending on how you direct your pen, I'm only talking about pen now, not line cartridge. Depending on how you direct your pen, you would achieve either more or less contraction. And of course, the number and spacing of your sessions. I find with Liftera treatments, no matter what I want to address, usually 1 or 2 sessions are enough. However, patients do come back, and it's great to know that if they do want to come back 3 months later, it is not dangerous to repeat a treatment. So let's go around my treatment protocols and techniques. We are currently leaving the era of GLP-1 agonists. Everyone and their sister are on some form of slimming injection, at least in the cities where I work. And all of the aesthetic journals show that this is it's a trend bigger than Botox right now. How does that affect us as aesthetic practitioners and as dermatologists? We're experiencing a lot of changes in the skin. Changes in the skin that are not relevant to losing fat quickly. We now know there's a lot of metabolic pathways involved on how GLP-1 agonists work that in some sort of way cause quicker degradation of collagen and elastin. We know there's the Ozempic face, there's also the Ozempic body. There's also another side effect to the GLP-1 era, and that's emotional. So there's a trend in fashion shows. We're going back to the anorexic model, and that causes more awareness regarding the physique of the patient. So although they will lose weight, they will worry more, not only about the skin laxity, but about localized fat pockets. And there's a reason why I'm mentioning this. So I have summarized most of my STAR treatments, but I decided to give more time to the knee perfecting protocol. Now, a lot of you might think knee is a champagne problem. I promise you it isn't. I've always had patients who's asked me to help them with their knees because you can be slim, but your knee will always give off your age. I love to use Demi Moore as an example. The first procedure she ever had was a knee lift, and it got her the famous part in the striptease movie. So knees are important, even more so now. But what's more important is to assess what we need to do with the knee. Mertz has created a very nice scale about understanding the severity of laxity. And why is this important? Because this will help us understand, do I need to treat? Is MFU modality enough? Do I need to create a combination treatment? And then, of course, and you see further down, there's also knees that need shaping. So managing lumps and bumps. I'll keep it like that for now. So my Liftera protocol generally is what you see here, and this is actually a protocol we use for all our aesthetic treatments. I'm actually not going to spend time on this. What I want to do is explain this. When it comes to knees and body, but also face, but mostly body treatments, it's important to, as I said before, value skin elasticity. You need to learn how to assess that. Second, adipocyte distribution. Is there too much fat? Is there a lot of localized too much fat, or is it fluid retention? And this is a problem that happens very often. Patients say, my legs are fat, they actually have fluid retention. Patients think they have fluid retention, and they actually have fat. I must say, using ultrasound right now makes it much easier. You don't need to rely on assessing yourself, but it's very important to differentiate. And I must say, Liftera helps with both, of course. And then, of course, assess the lymphatic circulation of the patient, because that will give you also a good indication of how quickly they will see the result of the treatment. Very important, BMI. For me, BMI is important not only for the body, but also for treating the face. For the reasons we explained earlier, I don't want to go over it again. Male, female, big difference. We know that. Why? Skin thickness, as my colleagues mentioned earlier. That's why I'm not staying there. One thing I always like to focus on, any aesthetic treatment that has to do with the use of an energy-based device is lifestyle questions. And I'm talking mostly about being vegan. So there are at least 3 publications showing that vegans versus omnivores need twice the quantity of energy you deliver to produce the same amount of collagen or elastin. So you always need to ask this question with your patient. Sometimes I actually refuse to give a treatment unless they have some increase of protein intake, which can be, of course, vegetable protein or whatever. And always, because we are doctors, although we forget that, take a good medical history, make sure you know what medication and supplements they're on. HRT, very important. Again, for example, testosterone, DHEA would affect the result of your treatment, and semaglutide, GLP-1 agonists, so on and so forth. Pre-treatment, well, the thing we all love about Liftera is this, it's a no-fuss thing, right? The basics. No anesthesia required. Of course, I'm very strict about no self-tan 4 days prior, whether I'm doing face or body. This might be because a majority of the people I look after are based in London. We have no sun, so everyone is using self-tan. Of course, no aspirin, ibuprofen, omega-3s, and alcohol. All is that is only to minimize bruising, nothing else, really. So, I've tried to cut the guesswork out of you if you decide you do want to start treating knees. So here we are. I'll just move forward. Is this working? Anyway, I can shout, you can hear me. It's working? Great. So if we have no laxity, mild laxity, and moderate skin laxity, do I, and I'm asking this, would you treat case 0? So someone comes in and they says, I want you to help me with my knees, and they are 0. Would one treat it? Yes. Exactly. We would, and it's what my beautiful colleague mentioned earlier. Why? As in terms of prevention. We're doing it also to prevent. We know now, and I'm closing my talk with that publication, that microfocused ultrasound has a very good regenerative effect on the skin. So we would see a minimal improvement, but we would work a lot in banking toward the future. However, number 1 and 2, I would say, are about 75% of the patients you would see. And to make it easy, I'm always referring to the pen, and that's why it's great. With linear cartridges, you're never able to treat a knee like that. You couldn't get into the little nooks and the valleys and the hills of a knee. Here you can. So we're doing 4.5, 3, 2, and 1.5 at 100 shots each. And again, I'm focusing the importance on speed. You don't want to be too fast. You don't want to be too slow. The problem with the knee, it is quite a sensitive area. You just need to do some verbal anesthetic with your patient. It helps time go by. Okay, and the next one. Here, we would need to move toward a combination treatment. So usually the combination would be Liftera, RF, if we had it in Europe, the amazing new monopolar RF, as Terasis has, and then probably some injectable biostimulator, for example, hyperdiluted PLLA, equine collagen, whatever is allowed, sorry, in the country where you practice. However, how I would do it would be, first treatment in clinic would be only Liftera, using 4.5, 3, 2, 1.5, 100 shots. I would ask my patient to come back 4 to 6 weeks later, because that's how long it takes to see the collagen remodulation. And then I would tell them, of course, in the initial consultation that we might need to do a combination treatment. And then I would either do RF on its own, see them again 4 to 6 weeks later, and do my injectable biostimulator. And this is a different case. This is knee sculpting. So you don't really have a problem with elasticity here, right? It's mostly about improving the contour. Now, if this was a live patient, it would be wonderful to be able to touch and understand if it's fat or fluid. However, experienced colleagues here can tell that it's mostly fat. So here I actually do want to get some sort of adipolysis. I'm doing non-invasive things in my practice. So I would do injectable adipolysis, and then on the same day, and I'll tell you why, follow with a pen cartridge, a 7, because I want to go really deep and help reduce the fat cells. So a 7, a 4.5, a 3, and a 2, 150 shots, and 100 with a 2. Now, I'm sure all of you are familiar with Kybella, Aqualix, deoxycholic acid, basically. If you take time and read the directions, it says, following the injection, please follow with ultrasound treatment. So actually they work beautifully together. There's something similar you could do submentally, but because my colleagues covered the face, I thought I would focus on this. We do this, patient comes back to reassess 4 to 6 weeks later, and we decide if we need to repeat both or only the Liftera. Post-treatment is important. If it was only Liftera, nothing, but depending, of course, of what you used as a combination treatment, so if it is an injectable biostimulator, an RF, so on and so forth, you need to give the appropriate directions. Exclusion criteria for the knee, of course, pregnancy, but also trauma or surgery in the area. The consensus is 3 months, I say 6. And this is the fun part, additional tips and knowledge. I always get asked by my students at UCL, how do we combine energy-based devices with threads? So this is not me, this is a publication, but it's very simple. Either you do it on the same day. If you have already done threads, you need to wait at least 2 weeks. But remember, with MFU, we heat the tissue up to about 75 degrees. PDO threads start disintegrating at 110. So you need to be really, really, really like causing excruciating pain to your patient to actually dissolve the PDO. However, wait for 2 weeks for them to settle, and then you can have your treatment. And actually, they complement each other very well. I myself do a lot of procedures with absorbable sutures, and I find that priming the area with a Liftera treatment, so treating with Liftera prior to doing threads, really optimizes the outcome. So my most popular treatments in the clinic are glass skin. So I believe it was Iñigo, I can't remember. We do know there's a lot of publications, you can email me, I'll send them to you, showing that there's a huge improvement in pore size following Liftera. So if you combine that with a neuromodulator, micro droplets all over the skin. It really gives the glass skin effect. What I call open eyes. A lot of the people I look after have to do a photo shoot or film soon later, and they have partied the night before. So using caffeine together with a 2mm pen and a 1mm pen, I do 200 shots around each eye. It really brightens, depuffs, and lifts. Then this is the Instaface sculpt. Using a similar device, I actually won an award in AMWC Miami for this. So what you do, similar to what you said, you're actually giving this chiseled look to the face. My little tip is to, just before you start treating, inject some peptides that have an adipolytic minimizing effect. The pentapeptide 95 is very good for that. Then, very unusual but works really well, stretch marks. So for stretch marks, I do 4.5, 3, 2, 1.5. Why is pen useful? Again, because you're dealing with a curve, and a linear cartridge isn't as effective. And I personally combine it with hyper-diluted biostimulator. An abdomen makeover, extremely good results with this. Again, the pen cartridge is very helpful because the abdomen is circular. The pen cartridge helps go in the right direction. 4.5, 3, 2, 1.5, and injectable equine collagen, which is allowed in the United Kingdom. I know it's not allowed everywhere, but for me, for the abdomen, it works really well. BBL, which is what I presented for Liftera at AMWC in Monaco last year. You can have my full protocol if you want in more detail for that. And perfect elbows. I know my patients are totally crazy. As if knees weren't enough, now they want their elbows to look young. And I sort of started experimenting with it. I used to initially only use Profilo, but now I find that if I combined 300 shots of 1.5mm cartridge pen followed by Profilo, the results are really impressive. Now, I came up with this idea that the pen can also be an eraser. So very useful in your everyday practice, for example, to soften irregularities post-treatment, whether that is your injectable HA or your thread treatment. And post-surgery. Please don't take photograph of this. I work very closely with a lot of plastic surgeons. This gentleman, as if there are any surgeons here can tell, had a neck lift and had this huge problem right after. Normally, we would inject with a steroid. However, for a specific health condition he has, that was impossible. I asked the surgeon if it was okay for me to use Liftera, and literally so within 8 weeks, that's the improvement we got. So it's good to keep in mind, and I actually shared this with my colleagues at UCL who are surgeons, and they found it useful, because we all make mistakes, and it's good to know how to help them go back. Now, this is very, very interesting in my opinion. As you know, if we do get a patient with Ehlers-Danlos syndrome, it's very difficult to treat. Not only because of the extreme elastosis, but because there's a big risk of bruising because of their condition. The only treatment that is allowed in patients like that, and actually think of the emotional help it offers them, is actually microfocused ultrasound. I actually offer this in my clinic pro bono because I just think it's very good to be able to help people feel better. Now, just to summarize the advantages of TDT technology in the pen cartridge, as we all said, benign side effect profile, possible to treat hard-to-reach contoured areas, minimal risk of PIH. For me, the fact that you can treat the full spectrum of Fitzpatrick skin type is super important. No anesthesia or sedation, fast treatment time, but not speed of treatment. 0 to very little downtime after treatment. That's because we're doing combination. Ideal for combination treatment modalities, very high patient satisfaction rate. I want to move really quickly here. This is what I want to close with. It's what I mentioned before. For you who follow me in my talks, I'm passionate about regenerative medicine. I think it is the future of aesthetics. And it was wonderful for me to see that there actually is a publication, which makes sense, of course. I wasn't surprised, I'm just happy to see it. that shows that actually microfocused ultrasound helps very well in preserving the skin envelope. And more of us, I think, daily have young people coming to our practice and saying, I just don't want to get old. I want to delay the aging process. And the younger the people are, the more knowledgeable they are, the more aware they are, and the less filler injections they want. So I think it's one of the best options we have to be able to accommodate everyone. Thank you.
To close our session, I would like to invite Dr. Pedro Santos.
Good morning, everyone. I will try to shrink my presentation in the 5 minutes that we have available. I will discuss with you one pretty common concern in our daily practice, that is the double chin. I will move forward these Liftera considerations that I think that we are all aware, but about diagnosis, where the whole process starts. We have to acknowledge that the double chin has multiple etiologies, and we need to have a proper diagnosis to address the issue that we are dealing with. Treating the submental fat, we have to know that we are only able to reach the pre-platysmal fat. Everything that is below the platysma is surgical, period, okay? What we should do is to proper diagnose the layer of the tissue that we have to treat, and we can address that using an ultrasound or using a clinical pinch test, okay? And I will guide you through that. What we want to treat when we see a double chin, mainly 3 things. First of all, and obvious, retract fat or reduce fat volume. Another way, we have to have in mind that the fat tissue, the adipose tissue, is not only fat. We have the stromal tissue that we have to address to shrink and compact this area, okay? And the last part is to contract the skin to adapt to the new volume. One thing that we always have to acknowledge also is that when we see standard protocols, all of the standard protocols use the 4.5 millimeter cartridges, even line or pen to the submental area. But if we have an empty neck, please have in mind that the platysma is usually 2.6 to 3.2 millimeters depth, so there is no sense to use the 4.5 millimeters cartridge. So, what we are doing using the cartridges that we have, starting from the superficial to the bottom area. With the 1.5, we are increasing dermal thickness and stimulating our fibroblasts to produce collagen and elastin. On the 3 millimeter cartridge, we are addressing not only deep dermis, but mainly retinacum cutis to shrink the structure and compact the skin, fixing on the superficial fat. On the 4.5, we are working mainly on the SMARS, and basically we are improving the support of the superficial tissues and doing some degree of tissue repositioning. On the submental area with the 4.5, usually we are directly working on the fat, promoting not only lipolysis, but adipocytolysis too. And with the 7 millimeter cartridge, we are also working with lipolysis and adipocytolysis, but also contracting the septa of the stromal tissue of the adipose tissue, okay? This leads us to a compactation effect. So, how should we assess the patient? Doing an ultrasound measuring to the superficial layer of the platysma, or doing a pinch test. With a pinch test, what we should do is divide by 2 to have our thickness value. Having that, basically, we are applying this protocol. And our starting point in the protocol is our thickness. If we have a thickness that is greater than 8 millimeters, we'll start on the first line. If it's greater than 5 or 4 are our 4 reference lines. And if we have more than 8 millimeters, we start with the first line and do all them till the very last line, okay? Basically, the thickness allows us to choose our first step, the line to start, and then we move downwards till the bottom of the protocol, okay? What kind of result, usually you need 3 sessions every 6 to 10 weeks apart, because we need to give time to the apoptotic effect to get to the point that we need. And usually it's better to combine with lowered third treatment to address the insertion of the platysma. Results that we can achieve. These are 3 sessions with this protocol. We have this fantastic reduction of the double chin. Please note that we start to see the shadowing of the mandibular contour, and this is only the Liftera effect. There are not other treatments in this area. Another lady, this one with an empty neck, but also with a nice definition of the cervical mental angle. This case, we note a mild improvement, but let me tell you that there are 8 kilos more. The patient gained 8 kilos from the first to the second photo. So even with the weight gain, we have the permanent fat reduction with microfocus ultrasound and with Liftera. And this other case, a young case of a patient that wanted 2 things. First, improve the double chin. Second, to improve the mandibular border and the mandibular definition, and to somehow have a better face definition with some volume loss on the lower third. These are 3 sessions after. Please note the improvement on the cervical mental angle, but also the definition of the goniac angle. And if I show you from the front, please note reduction on the bigonial area. When we compare to the first photo, we almost see a straight line between the zygomatic arch and the goniac angle, and here we have the zygomatic contour, okay? So, thanks for having us. I don't know if we have time for questions. Thank you very much.
Okay, thank you. Thank you, Dr. Pedro. We have a few minutes for questions. If you have any questions, please let us know. I would like to invite the speakers to come to stage to answer the questions. Anyone? Someone? Wait a second.
Thank you so much. I would like to ask to Dr. Anna regarding the deoxycholic acid post, because how deep will you go, or would you wait? You just do the injection and do it on the same session? You wait a few days?
Is this on? Yeah, good. So I wasn't probably clear because I was in a hurry to be on time. The decision if I do it on the same session or not, to make it clear, is not mine. As I said, it's actually on the instructions of whichever product you use, and it actually says to do it on the same day. It makes sense for 2 reasons. First of all, you're dispersing your product, and you're also minimizing the risk of side effect, which, as we know, is necrosis, right? So the more you disperse it, the more you're reducing that risk. So I do it on the same day. Now, the level of my injection, make it clear, I use cannula, okay, would be you pinch the fat and you go right in the belly of the fat pad, okay? I always undercorrect, because if, for example, you needed 0.5 mil to contour a knee, combined with a good Liftera treatment, you only need 0.25. So I do that and then reassess. There is edema because of the deoxycholic acid. However, it's for about, I don't know, 5 days, and that's it.
Would you do the same for the jowl area?
As I said, yeah, I said earlier, so I do it a lot for the submental and the jowl area. However, For the face, I do not use deoxycholic acid anymore. I use adipolytic peptides. I find they're safer and they give a more elegant result.
Thank you.
If I may give a suggestion regarding to body treatments, don't be economic, right? Use the most amount of shots that you can, and always, if you have an opportunity to combine with the biostimulator, do that, because patients become very, very happy, right? So it's always very good.
Anyone? Any more? Someone? Of course. Yes, we have 5 minutes. Okay. Anyone? Oh, please, could you?
Dr. Olsen, you mentioned before around with the Liftera, there's a lack of pain, particularly for treatment. And you mentioned that you maybe draw some comparisons to other high-flow devices. And you mentioned also ultraformer. Can you draw a comparison between the two?
I can. I'm not sure I don't know if we're allowed to do it, but everyone knows I was an Ultraformer 3 user. I was one of the first 4 to use it when it arrived in the UK. And I literally loved it until I came across the Liftera. First of all, I'd say yes, very simple benefits. One is, as I said, the TDT technology, which gives more efficacy in less treatment time, because you're delivering more energy in a better speed, in an optimal speed, which in result makes it less painful, easier to tolerate. And for me, genuinely, the advantage of having a pen gives so much precision and versatility. Those are the reasons why I prefer it. And also, it's a much lighter, sleeker, it's designed nicer as well. But in terms of practicality in clinic, that's why I switched from that to this.